If you're trying to heal yourself from thyroid disease, then stop eating these 5 foods. So the first thing is to stop eating cruciferous vegetables, or you can cook them in the manner that I'll explain in just a second, because cruciferous vegetables contain substances called goitrogens. Now, these goitrogens block the function of something in the thyroid called the sodium iodide symporter. That's like a transporter that takes iodine from your bloodstream and brings it into your thyroid. Now, why is that important? Well, your thyroid makes a thyroid hormone called thyroxine, also known as T4, which has 4 iodine atoms. So we need to get the iodine from the bloodstream into the thyroid gland. It's the sodium iodide symporter that does that. But here's the problem. Cruciferous vegetables, they contain these goitrogens and they mess it up. They block the transporter. Kind of like if you were trying to take the train to go somewhere on vacation, but someone put a whole bunch of logs and bricks on the train track and the train couldn't move, you couldn't get there. Well, that's what these goitrogens from cruciferous vegetables do to the sodium iodide symporter. So the second problem with these goitrogens is they inhibit a very important enzyme in the thyroid called thyroid peroxidase. And the reason why that's so important is thyroid peroxidase takes an amino acid that you get from protein from your food called tyrosine. That enzyme takes tyrosine and it combines it with iodine to make your thyroid hormone. So thyroid peroxidase kind of smushes together your iodine and your tyrosine to manufacture that thyroid hormone. Well, your goitrogens mess that up as well. So if you have hypothyroidism, you really want to avoid or reduce your consumption of these cruciferous vegetables, or you want to boil or steam them, because boiling or steaming them reduces the goitrogen content between 60 and 90%. So it really reduces it quite significantly, makes it much more safe for primary hypothyroid cases. Also, you want to make sure you have good iodine in your diet if you are eating cruciferous vegetables, because again, some of that iodine is going to be blocked by the goitrogens that are in your cruciferous vegetable. Second food you want to start eating is gluten. And the reason why is gluten contains a protein called ghalatin. Ghalatin, that protein is similar in its appearance to an enzyme that's made in the thyroid gland. The reason why this is a problem is when you consume gluten and it contains this ghalatin, which can be inflammatory for a lot of people, the immune system starts to attack the ghalatin. But then through the process of what's called molecular mimicry, the immune system goes, well, wait a second. That enzyme in the thyroid gland looks a lot like this ghalatin that's in the wheat, and that ghalatin's bad. So I think the enzyme in the thyroid must also be bad. So let's start attacking the thyroid. Hello, Hashimoto's. Hello, Graves' disease, hello, autoimmune disease as a whole. So you really want to make sure you get gluten out of your diet because it has that protein ghalatin, which can confuse the immune system and possibly spark and or worsen conditions like Hashimoto's or Graves' disease. Number 3 is a big one, and number 4 is probably the biggest one for thyroid case. But number 3, you want to stop refined sugars, basically table sugar, all the junky sugars you have in your candy, sweets, and treats, as well as refined carbohydrate. Anything that's going to shoot your blood sugar up really high. So anything that's high on the glycemic index for sure, you want to avoid. The reason why this is a problem is when you're eating these simple sugars, these simple refined carbohydrates, they shoot your blood sugar up and then your blood sugar comes crashing down. When your blood sugar comes crashing down, your adrenal glands respond to that by raising cortisol, because cortisol helps push up your blood sugar. The problem with that is cortisol also interferes with the conversion of T4 to T3. Remember, T4 is your kind of inactive thyroid hormone. It doesn't do all that much. It has some roles and functions, but not like T3. T3 is the active form of thyroid hormone, the thyroid hormone that helps you have energy, helps the brain work, helps your nails grow, helps your hair grow, right? Helps your skin be healthy and vibrant. So it is cortisol that interferes with the conversion of T4 to T3. The other thing is when you eat those simple, sugary, junky, refined carbs. Now, I'm not talking about healthy sugar from fruit like an apple or blueberries or something like that, which are generally lower on the glycemic index. Anyway, I'm talking about all the junk sugars and refined carbs that you guys know I'm talking about. So those things, they also put a lot of stress on the liver, and they're one of the leading causes of fatty liver. Why is that a problem? Well, T4 is converted to T3 in your liver, meaning about 80% of the T4 that's produced in your thyroid travels through your bloodstream, goes to your liver converts it from T4 to T3, the active form. When your liver is fatty and being overly stressed by refined carbohydrates and sugars, the liver doesn't do that process as well, and it becomes harder to activate your thyroid hormone. If you have tons of T4 and not enough T3, you're basically hypothyroid. Sorry, you have to convert your T4 to T3. And this is true. Listen up. People on Synthroid or any thyroid medication that's T4, Synthroid is essentially synthetic T4. It has to be converted through the liver to T3. So these refined carbs and these elevated sugar can cause, again, elevated cortisol. So the stress on the liver and the stress on the adrenal glands, both of those can stop the conversion of T4 to T3. It doesn't matter if it's a medication. If your medication is T4, it's not going to get converted to T3. Now, if you're taking actual T3, obviously it's already converted. But we're talking about people on Synthroid and people on other medications that are essentially T4. Okay, number 4, this is probably the worst culprit. It's industrial seed oil. And I'm going to tell you why. It's not for the reason you think. These industrial seed oils like cottonseed, soybean, canola, so on and so forth, what they do is they damage the THR. THR stands for thyroid hormone receptors. These are special receptors called nuclear receptors. They sit all over your cells. They're in the cells of your brain. They're in the cells of your liver. They're in the cells of your gastrointestinal tract. And the thyroid hormone has to plug into those receptors to get that cell to function properly. So for your brain to wake up, think, focus, concentrate, that T3 has to plug into that thyroid hormone receptor, that THR, on the surface of your brain cell. And if that thyroid hormone receptor is damaged due to the consumption of inflammatory seed oils, you're in trouble because now the brain cell can't work. Look, that thyroid hormone plugging into that receptor is like a key for your car engine, right? Or the push button, because hardly any of us have keys anymore. The push button for your car engine, right? You need to push that button to turn your car on. You need to put the key into that ignition switch and turn it to get that engine to turn on. You want a brain cell to turn on? You have to have thyroid hormone in that thyroid hormone receptor on the brain cell. If you don't, you're in trouble. You're going to be looking at things like anxiety, depression, problems focusing, problems remembering, problems concentrating, and this could simply be due to too many seed oils damaging your thyroid hormone receptors. But here's the issue. It doesn't stop at the brain. How about your liver? Well, your liver cells have thyroid hormone receptors all over them. And guess what? If those thyroid hormone receptors are damaged, your liver cells are not turning on, meaning they're not working at the capacity they need to, which means we're looking at things like liver malfunction. Your liver has how many different functions? Over 500 functions in the human body. Well, all of those functions could potentially be compromised to one degree or another if we're consuming these seed oils and we're having damage to those thyroid hormone receptors on the liver cells. Again, though, it's not just the brain and the liver. How about your muscles? Your muscle cells have thyroid hormone receptors. Again, if those receptors are damaged, we're looking at muscle weakness. We're looking at fatigue. We're looking at aches, pains, poor recovery time. Our heart and our blood vessels have thyroid hormone receptors. So we can potentially look at cold hands, cold feet, cardiac problems like slow heartbeat or elevated heartbeat in some cases if those receptors are very aggravated. If these seed oils have damaged thyroid hormone receptors in the gut, we could be looking at constipation, because the gut cells are not moving, right? You don't get that normal contraction of the intestinal tract. You don't move the stool through, so you get constipated. When you get constipated, you're more inclined to have increased inflammation in your body. You're more inclined to developing things like SIBO, bloating, and just a slower digestive process. We also have skin, nails, and hair. If those thyroid hormone receptors are damaged due to the inflammation caused by these seed oils, we're looking at dry skin, brittle nails, hair loss, puffy eyes and face. This can affect women, looking at low fertility levels, men, low testosterone levels, abnormal cycles, loss of period, abnormal menstrual cycles, abnormal periods. The list goes on and on. I could really be here forever because these thyroid hormone receptors are in every single cell in your body just about. So you don't want to introduce a lot of these inflammatory seed oils that have the potential of damaging those sensitive thyroid hormone receptors, those nuclear receptors that line all the surfaces of your cells. So if you just do one thing, I'm telling you, kick the seed oils. Just get these seed oils out of your body. Replace them with good healthy fats like coconut oil, olive oil, especially high mountain olive oil. I love Little Gypsy Farms. They don't pay me anything to say that, but I love their organic high mountain extra virgin olive oil. It's just the best. Literally 5 times the antioxidant content in that olive oil compared to many other olive oils. So we could look at tallow, at ghee, at really good quality butter butter that comes from organic cows or cows that are pasture raised, truly pasture raised, grass fed from beginning to end of their lives. They're out there, they're on the pasture most of their lives. It's that type of butter that can be beneficial. The next one, and I'm sorry to say it, is alcohol. Problem with alcohol is it has the potential of raising estrogen levels in the body. The reason why estrogen is so damaging for thyroid cases is it increases a substance, a protein in the liver called thyroid bonding globulin. Thyroid binding globulin binds to your active thyroid hormone. It literally binds to your thyroid hormone and prevents it from doing its job. In addition to that, elevated estrogen levels activate certain parts of the immune system that you don't necessarily want activated, especially if you have a familial history of autoimmune disease. The reason why is when you activate this part of your immune system, it increases autoimmunity. Now, if you just did a simple comparison, like women have about 500% to 1,000% more estrogen in their body than guys. And when we look at the relevance of autoimmune disease like Hashimoto's, for example, Hashimoto's is 500% to 800% more common in women than men. So let's just do the math. Women have 500 to 1,000% more estrogen, and they have 500% to 800% higher likelihood of developing Hashimoto's. Why? It's due to the estrogen. Now look, there's nothing you could do about the estrogen, but what you could not do is don't fuel the fire, right? Don't add a bunch of alcohol to your body, elevate your estrogen levels, and potentially ignite that spark that may be connected to the Hashimoto's that's in your genetic line. So we want to avoid things like that. Also, we don't want a whole bunch of thyroid binding globulin floating around in our bloodstream. So we got to ditch the alcohol. If you're going to drink, I mean, you're talking just a couple drinks a week. I would go with a really high shelf tequila, as tequila does have some prebiotic substances in there. It can have the potential of supporting a healthier blood sugar level than some of the other alcohols out there. Okay, so if you have thyroid problems and you just yank those foods out of your diet, especially if you just get rid of like the seed oils and the alcohol, chances are you may start experiencing some relief or some improvements with thyroid. Also, watch the other videos I have on here on thyroid and thyroid health. There's a ton of info. I've been working with thyroid cases for over 28 years now. I've been in private practice for that long. Plus, my clinic and I have worked with over 50,000 patients and clients. So this is something that we work with quite often. So look at the information I have here on the channel, take it, use it for yourself. Hopefully you can help yourself. Again, this is educational information, so definitely check with your doctor beforehand, but take the info, learn it, use it if your doctor says it's good, and do what you need to do to get yourself healthy. Because the truth is, there's a root cause to every health problem that's out there. You just gotta find it. See ya.